Supporting our communities. What is meant by vulnerability? Vulnerability refers to the ability of a person or population to withstand, respond, and recover when affected by a hazard. The vulnerability of a person or population can be affected by various factors, including demographics and geographical location. Why is it important to understand vulnerability? Click to find out more. Evacuation. Vulnerability can affect the ease and time taken for a population to leave an area at risk from volcanic hazards during an eruption. This is commonly due to mobility issues, lack of vehicles, or restricted road access. Access to services. People that rely upon services for survival become more vulnerable when these services are affected by volcanic eruptions, limiting their access. This may include medical equipment requiring electricity, medication, social services, etc. The impact of limited access to services depends on the situation. Some people face more extreme and immediate vulnerability, and they often require additional support to stay safe. Communication. People can only respond to warnings if they can receive and understand them. Communication can be harder for those with language barriers, no internet access, or sensory impairments. These challenges can delay important warnings, which is especially important during fast-changing volcanic eruptions, like the 2019 Wakari eruption. Recovery. People who are already vulnerable often take longer to recover after a disaster, as do not have the capacity or resources to do so. Although New Zealand is a high-income country, some communities still face challenges such as low incomes, job loss, and limited access to housing. These factors slow down recovery and mean people may need further support in the weeks and even years post-disaster. Who may need extra support? It is important for everyone to be aware of people they know who may require extra assistance prior to, during, and post-volcanic events. Here are some examples to keep in mind, but remember they are just assumptions and often vulnerability varies a lot between people. Hover over the photos to learn more. Younger children. Limited understanding of volcanic eruptions, so rely on adults for warnings, safety, and reassurance. Older adults. More likely to experience mobility or health challenges, making quick actions and evacuations to ensure safety harder. People with limited English proficiency may struggle to understand the hazard warnings and evacuation instructions quickly. People relying on medical equipment may have to leave medical equipment during evacuation, or loss of electricity may prevent equipment use, posing an immediate threat to their health. People part of the LGBTQ+ community may face barriers to accessing safe shelter, support services, and networks during volcanic eruptions. People with disabilities may require mobility assistance or tailored communication to meet their needs, include those with hearing and vision impairments, mental health conditions, and much more. People pregnant may have increased medical and mobility requirements during volcanic emergencies. People who are tourists, unlikely to be fully aware of the risks associated with volcanoes, necessary evacuation routes, and New Zealand's alert systems. People with medical conditions may be unable to access essential medication, appointments, and environments required to control symptoms. Social and economic influences. A person's social and economic situation can also affect the ease of their preparation, response, and recovery to a volcanic eruption. These are often wider society issues rather than individual decisions that have resulted in these situations, and so it is important as a community to understand how people can support each other throughout challenging times. Hover over the images to learn more. Housing, access, and housing conditions. Some households may have reduced access to supplies, safe places to go, and relevant information. Auckland has the highest homelessness rates in New Zealand, which can affect ability to access shelter and warnings. Older homes may be less able to withstand ashfall, as currently there are no building standards to protect against volcanic hazards. However, those with less connections to a place may be more willing to evacuate quickly. Transport access. People without access to a vehicle may find it harder to evacuate quickly. Remote and rural areas often have limited road access, which can be disrupted by ashfall, lahars, etc., causing closures. Even in developed areas like Auckland, large-scale evacuation would result in significant traffic congestion. Internet access. Limited digital access can increase time taken to receive real-time warnings. Cost barriers can make it harder for some to access important information. However, New Zealand's mobile emergency alerts are designed to reach as many people as possible. They do not require internet or mobile service, helping to close this gap. Financial stability. Financial stability can affect how easily people prepare for and respond to a volcanic eruption. People with limited income may struggle to take time off work for precautionary evacuation. Those without insurance may hesitate to leave belongings due to worries around replacement costs. Kaitaki Connect.